We don't at this stage. You know, the biomarker story, especially around PD-L1, went up and down a lot in renal cell cancer. We have evidence that PD-L1 as a biomarker, that's what we know, does worse with systemic therapy. Patient that get systemic therapy, VEGF target therapy, you know, for example, do worse if the PD-L1 marker is positive. On Checkmate 025, when everolimus compared to nivolumab won hands down based on survival benefit and response rate. And patient derived benefit irrespective of PD-L1, although PD-L1 positivity was associated, you know, arm per arm with worse outcome. Having said so, what we saw on Checkmate 214, which is the combo frontline of nivolumab, ipilimumab versus sunitinib, something different. Survival, which is one of the co-primary endpoint of the study, overall survival, actually was achieved irrespective. But this was different because if you look at the hazard ratio and the magnitude of benefit for overall survival, it was much more in those 30 patients, 25, 30 patients that were PD-L1 positive by the definition of the BMS test. Having said so, if you look at progression-free survival, another co-primary endpoint of the study, despite survival, you know, being independent somewhat, progression-free survival in PD-L1 negative patient was the same as sunitinib, depending what you look at. So I think overall survival usually trumps all endpoint in my view. I do not use it, but it's a very intriguing biomarker, at least here.